Hello, my name is Dr. Michael Smith, and welcome to Integrative Health Solutions. Today, I want to talk to you a little bit about understanding autoimmune disease. Now, autoimmunity is a very complicated thing. At present, there are over 120 known autoimmune conditions in modern medicine. Right now, 1 in 6 people who's walking around with illness is walking around with complicated autoimmune disease. And at present, 1 in 3 people who are dying in the hospital of chronic illness are actually passing away because of an autoimmune disease. So that's a pretty serious aspect of modern health, modern culture, and modern life. So what I'd like to do in this video is just walk you through an understanding of autoimmune disease in general, and specifically what we call the autoimmune spectrum, which is what gives most people with a complex condition an appreciation of what's going on physiologically. Now, when it comes to those over 120 diseases that I mentioned, every one of them has their own unique name and, kind of what you might consider their own unique kind of pathology and potentially their own unique kind of treatment. But it's very easy to get distracted by the name of the condition and, what someone, up until recently has decided is the standard of treatment. Because when you start looking at autoimmune disease as a spectrum instead of as a fixed name diagnosable condition, it's much more empowering for us as clinicians and for us as patients to be focusing in on, the bigger mechanisms and the bigger kind of aspects of physiology and momentum, because those are happening to everybody and they're things that you can usually see based on any rapidly changing symptoms or any rapidly changing symptoms in response to a medication. So it's really more important, in my experience, to focus in on what you might call the climate or the underlying balance-imbalance ratios in the body than just trying to treat the bumper sticker or the name or the label of the disease. So I'm just going to change the screen over so that we can look at that spectrum kind of in a sequential way. So let's check that out. So as you can see, there's 5 stages to what we call the spectrum of autoimmune disease. So when you're looking at a person's medical history, and as clinicians, that's the first thing that we do, when you're talking to people who actually have autoimmune disease, almost everyone started off fairly young with some kind of allergic reactions. Now there's allergies that are obviously very common, like hay fever, and then there's allergic reactions that turn into things like asthma or eczema or constipation or mood changes or insomnia or all kinds of other things that essentially, set up a group of symptoms, put a lot of burden on the body, especially the immune system, and eventually start to change the way the immune system looks at the world, because an allergy is usually an overreaction to something that's normal. So if you're a kid, 2-year-old, maybe 4, 8, 10, 12, and at some point your physiology and your immune system start getting more and more aggressive and they, start attacking your sister's hairspray or something on the plate for dinner, obviously the nature of your immune system is going to become more and more compromised. So again, when we look at the spectrum of autoimmune disease and we think of it in stages, the first stage is people who just start to have really weird immune system overreactions to the world. Now, that doesn't mean everyone who's ever had an allergy is going to end up with a, chronic degenerative disease. But it definitely would be considered, an important flag, because when you're looking at this as a spectrum, it's trying to understand if you fit into it and where you fit into it, and probably more importantly, how rapidly you're progressing through that spectrum. So a lot of people have allergies that it never turns into anything. However, there's a lot of people who have kind of weird random allergies that come and go that later on in life are typically going to be diagnosed with some kind of chronic condition. Now, this is where it gets a bit tricky, because the initial diagnosis doesn't always have to be a fixed name autoimmune process. It could be any number of other things that may be considered a satellite to or next to an autoimmune process. So it isn't always that the initial diagnosis, again, is an autoimmune disease, but now you're having a person who, say for 10, 15 years had mild, erratic, annoying allergies and, say breakouts of eczema or bouts of seasonal allergies or asthma or something like that. So again, if a person's having that much trouble with their immune system and then they start getting, say in their 20s, some initial diagnosis that requires treatment, you could say, and I'm kind of just making this number up, but you could say 50% of people are going to get a non-autoimmune diagnosis, or 50% of people are going to get an autoimmune diagnosis as their initial condition. And usually what most people do is they take the treatment very seriously. They take any dietary advice, lifestyle advice very seriously, because it's their first real brush with any kind of significant health concern. So what happens for a lot of people is that initial scare, that initial diagnosis comes along, and they do everything they can to right the ship, as the expression goes, and may get away with no more problems the rest of their life. More likely, though, is in maybe 10, 15 years, that condition is actually going to come back and, be considered now chronic. It's going to require treatment as well. So for a lot of people, now you're having a fixed name autoimmune disease. They have you on some kind of anti-inflammatory, potentially some kind of immune suppressant. And if you're lucky, that initial more aggressive treatment towards that chronic fixed name autoimmune condition has suppressed the symptoms and given you enough motivation to maybe change some things and remove some triggers. And if you're lucky, and I mean that literally, if you're lucky, in stage 3, when things become chronic and treatment usually becomes also chronic as a requirement, this is where the negotiation really begins, because now you're either going to be doing everything you can in terms of natural medicine, integrative medicine, lifestyle, diet, supplements, stress reduction, some kind of treatment, to do everything that you can to stop it from progressing and hopefully reverse it back towards around that stage 2, where you're not having to be under chronic treatment in the sense of pharmaceuticals, and the spectrum is no longer progressing, at least not now. So again, a lot of people, when they hit that stage 3, if they're doing everything they can, they're going to live about 15, 20, 25 years, probably, if things go as well as we could hope. You're going to get that 20, 25 years without any huge changes in your health. And if you're lucky, you'll get through the rest of your life just on whatever treatment is maintaining the status quo. Typically, however, if you do have chronic complex autoimmune disease, you are progressing along the spectrum and you have been diagnosed, it's now chronic, you require treatment, it's into stage 3. What usually happens for people, 15 years in, and or, shorter or longer, depending on all the things that can trigger this to get worse, this is where we see people starting to switch over into stage 4. Now, stage 4 we call chronic reactive inflammatory autoimmune disease, because not only is it a chronic illness, it's now kind of a weirdly reactive situation where, you bang your hand trying to fix your car, and then you end up with what looks like an inflamed, red, swollen, and potentially arthritic joint. Maybe you eat too much spicy food, and then you end up with some chronic ulceration to your gut, causing more immune system aggression, causing the whole process to get to the point where you might have some kind of esophageal distress. Obviously, this can go anywhere, and the more your skin interacts with the world, the more it can react with an inflammatory autoimmune process, say like psoriasis. The more you breathe in evaporants, the more you might trigger something like a more severe kind of asthma, or even something like COPD. So this is where the rubber hits the road in the sense of, just in the sense of autoimmune disease, because now you require treatment, and you require treatment that's more aggressive, and now the treatment may have to chase around your body and your organs what's going on. And this is usually in modern medicine, where the name for what's going on is usually just an abbreviation for the whole umbrella of everything that's actually going on with people. So once it's in this stage, to stage 4, honestly, you really just need to spend, every hour of every day doing everything you can to swing it back towards stage 3. And if you're lucky, to stage 2. I have seen that happen. It is possible, but it would take probably a couple of years for most people to go from stage 4 back to stage 2. So stage 5, we would consider the degenerative and progressive aspect of autoimmune disease. And this is usually when it becomes Obviously life altering, because at this point most people are going to be in a wheelchair or bound to a bed, or worse, be in a hospital or in some kind of hospice situation, because at this point usually this is the end stage of the illness. Typically, when a person's at stage 5 of the autoimmune spectrum, it is possible, if you're very, very fortunate and you have really, really good response to medication and other supplements and dietary changes and stuff, it is possible to reverse it somewhat. But typically, when the body has broken down enough and the immune system has become erratic and aggressive enough, that you would be in full-blown stage 5 for the rest of your life. It's hard to say if that's, months to years. It really depends on the condition, and I'm, not wanting to be too morose here. So very quickly, everyone with an autoimmune disease is going to fall onto this spectrum. Where you fall in the spectrum is going to indicate how seriously and how aggressively you're going to have to focus on the treatment. So keep in mind, no matter where you fall on the autoimmune spectrum, could be, stage 2 all the way up to stage 4 or 5, there's always a chance that you can do something to reverse the process somewhat, to prevent it from getting worse somewhat. I've been in practice over 20 years. I've been dealing with autoimmune disease for over 25 years. I'm very confident in saying that once you understand where you are on the spectrum of autoimmune disease, and in the next video, which is going to be called Autoimmunity, What to Expect, I'll walk you through what I usually walk my patients through in the sense of sort of step 1, the things that are going to make the most difference the soonest, in the sense of choices and maybe more importantly, just really clear distinctions and what you're committing to. So check out that video. If there's anything I can do for you, please shoot me a question through my website or throw a question in the comments below this video. Always keep in mind, when it comes to autoimmune disease, do not get distracted by the label. Focus on where you fit into the spectrum. Focus on everything you can do to turn down the reactive part of your immune system. Do everything that you can to modulate your immune system. There are so many people that I've seen, 80-85% of people turn around complex fixed name diseases with lifestyle, diet, supplements, treatments, meditation, and a lot of learning. So again, hopefully this video has given you some insight to getting started. Hope it helps, and have a great day. Thanks.